here. First, job creation. The Commission calls for a humanitarian crisis. Yet, gender bias remains an important challenge for health workers. Education, training, and skills. All countries can do more to prioritize investment in education. Education models should shift away from narrow specialization to focus on lifelong building of locally relevant competencies. Generally, there is a need to relax unnecessary barriers to entry. Addressing geographical inequities is a priority, and demographic transitions present opportunities to strengthen youth education for employment in the health sector. Evidence reinforces the effectiveness of community-based health workers, including health professionals, as well as other cadres. Health service delivery and organizations. Health systems organized around clinical specialties and hospitals will need to shift towards prevention and primary care. This is very relevant for Indonesia, given the impact of JKN. There is no prescription for a perfect mix of public and private provision. Governments need to adopt policies that cover the performance of the whole sector. Social business models are emerging as a private sector, socially oriented solution to serve the unserved. Public policies and regulatory bodies must protect the interests of public and ensure that professional interests are not dominant. Technology. Rapidly changing technologies are already changing the nature of health services. New cadres of health workers are emerging, enabled by information and communication technologies. Digital technologies also provide the opportunity to enhance people's access to health services, improve the response of health systems to the needs of individuals and communities, and improve the delivery of a wide range of health services. Financing and fiscal space. Most countries can secure sustainable health financing, assuming continuing growth in public revenue and necessary priorities to the health workforce. Societal dialogue and political commitment are critical to drive the appropriate macroeconomic reforms and health financing policies. Public policies can also attract co-investments by the public sector. Crisis and humanitarian settings. Each country needs to build the capacity of its health workforce and health systems to detect and respond to public health risks and emergencies. Partnership and cooperation. Achieving a fit-for-purpose health workforce requires action across all sectors involved with the health labor market. These intersectoral processes must engage public and private sectors, civil society, trade unions, health worker associations, non-government organizations, regulatory bodies, and training institutes. International migration. Demand in high and middle-income countries is likely to continue to drive health worker migration in the years ahead. As we know, several developed countries have approached Indonesia for migration of nurses, for example. The Commission recognizes that the international mobility of health workers may bring numerous benefits to the source and destination nations and the health workers themselves. However, the adverse effects of migration must be mitigated, and our capacity to analyze data is needed for labor market analysis and research. The strength of the data architecture depends on the active engagement of communities, health workers, employers, training institutes, professionals, and the regulatory bodies. The Commission's recommendations speak to the change in the structure of a country's population, and therefore mainly to the labor market impact of the demographic dividend. But productivity of this labor force is equally important. And here, health itself has an important role to play. Indonesia is currently challenged by the high and growing rate of the increase in non-communicable diseases. The health sector report in Indonesia, released earlier this year, estimates that NCDs are now over 60% of the burden of disease in the country. As global evidence clearly indicates, population in the productive age group are impacted disproportionately, and this trend is likely to increase, particularly in middle-income countries. Earlier this year, the World Bank released a report that introduced a new measure, the Human Capital Index. The HCI for a country can be between 0 and 1. The higher the value of a country approaching 1, the productivity of the population is in very high performance, supported by a healthy environment and good education. Singapore tops the ranking with a HCI of 0.88. Indonesia's HCI is at 0.52. This is better than the average in its income group, whose HCI is 0.48, but lower than the 0.62 average for East Asia and the Pacific. The report states that this reflects that while Indonesia has made good progress in recent years, there is still a deficit in human capital due to the accumulation of investment shortages over the past decades. The Institute of Health Measurement and Evaluation in the University of Washington in the US has been behind the development of the HCI. And while the HCI is still being debated, what is clear is that there is still a need in Indonesia to increase investment significantly so that health, education, skills, and opportunities for the younger generation are better, so that the country may actually reap the benefits of the demographic dividend, both in terms of labor market as well as in terms of human capital development. WHO remains a willing partner to support the health workforce strengthening for UHC in Indonesia. Thank you again for inviting us to the meeting. Thank you very much.
Thank you very much for the speech, Dr. Alaka Singh. And we hope you come forward to the stage because there's a giving souvenir from us. The mementos will be given to you by Mr. Arga Bunsara as a program coordinator ICHD 2019. Please come forward to Mr. Arga.
We would like to thank again to all our speakers and moderators for today. Please give applause for today's event. Thank you so much. Now we are at the end of this conference. We would like to thank all the guests, speakers, moderators, oral presenters, and participants who have already spared their time to attend this great event.
We would also like to thank our sponsors, CalCare and the Directorate of Health Promotion, Ministry of Health of the Republic Indonesia.
Media partners 5TV of UPN Veteran Jakarta.
And publication partner, Jurnal Kesehatan Komunitas, Jurnal Alma Ata, JMMR, Journal of Maternal and Child, Indonesian Journal of Health Development, and JIKM.
And also Jurnal Dunia Keperawatan, Jurnal Respirologi Indonesia, Journal of Nursing Care, Journal of Indonesia Health Policy and Administration.
And ladies and gentlemen, before closing, we would like to remind you that there will be a photo session. There is a photo session.
Participants, speakers, and guests to have a photo session.
And we invite all these participants, speakers, and guests to join us. For all these participants, please come forward to the stage because we're going to
have a photo session. Attention please, we would like to remind you to fill out this evaluation form so we can provide to improve the program for ICHD 2020. Untuk seluruh panitia juga diminta untuk memfoto bareng, ada foto sesi untuk panitia, dimohon untuk maju ke depan kembali. Terima kasih. Kepada seluruh peserta juga dimohon untuk mengisi lembar evaluasi untuk meningkatkan kinerja pada ICHD 2020.
And we reminder for all participants to take a certificate at the registration desk
Outside this ballroom.
ballroom.
And we would like to invite all the speakers to join the committee for the photo session. Thank you.
Ayo panitia, panitia.